Our last major new topic that we're going to be focusing on that is part of our global health unit is for us to take a look at HIV and AIDS. This is a huge problem around the world, and I guess especially in countries that don't have medical care like we have in the United States. There are treatments, not cures, but treatments, medications people can take to kind of delay the progression of AIDS, and it is expensive, so it's kind of currently not easily available for everyone. So it does fit into our global health unit, which is our last unit for anatomy 2. So here you can see what the HIV virus looks like. There are protein spikes on the outside that are unique to the HIV virus. It is an RNA virus. You can see its genetic material here. Viruses, again, are not cells because there are no organelles. There is an outer protein coat as well as an inner protein coat. Okay, so just kind of looking at some structure, there is a membrane around it, similar to, it's a phospholipid bilayer, so it's similar to the membranes of our cells. But HIV itself is the virus, so we're looking at HIV here. AIDS is not a virus. AIDS is not contagious. It is HIV that can cause a person to develop AIDS. So we'll get into that a little bit as we go through the lesson. So just some background vocab, and some of these might be more familiar to us now because of going through our current pandemic that we're in, hopefully the only pandemic we have to live through. But an epidemic is going to be like a smaller scale, so there's going to be an increase in the number of cases of a particular disease just above what you would normally expect, but it's a smaller scale, so it would be more localized. A pandemic is when an epidemic spreads over several countries or continents, or in the case of COVID, which isn't what we're talking about here, but just since it's an easy reference right now, it can be global as well. An outbreak is the same as an epidemic, but it's usually much more limited in like geographical spread. So it could be maybe like for a case of like food poisoning, could be an outbreak traced back to like the same restaurant, for example. Endemic is in reference to a disease being constantly present or being unusually prevalent in a certain population. And then hyperendemic is going to be persistent high levels of disease, well above what we see in other populations. So for example, since we're talking about HIV, that is hyperendemic in parts of Africa, where about 20% of adults have the disease, but it's endemic in the United States where far fewer people are infected. Here we just have, again, looking at epidemics versus pandemics. An epidemic is the disease is rapidly or actively spreading, and it's kind of getting out of control, but it's not so widespread yet to be considered a pandemic. A pandemic, again, is referring to geographic spread of the disease. So the disease would affect a whole country or many countries or even the entire world. So there is a pre-test for HIV, not on your paper because we're not on paper, but on your slides. So please, if you're watching this lesson because you weren't in class, pause your video and take that pre-test here, and then come back and I'll go through the answers. So here we'll go through just some true-false statements. Currently there is no known cure for AIDS. That is true. Sharing needles can spread the HIV virus. Also true. Humans can get AIDS from a toilet seat. Okay, that is false. Number 4, mothers can transmit HIV to their babies during pregnancy. That is true. Number 5, abstaining from sex and intravenous drugs provides protection from contracting HIV. That is true. Actually, the only 100% way to prevent that. Number 6, you cannot get AIDS from eating food that is prepared by a person with HIV. That is true. Number 7, people with AIDS die from opportunistic infections that usually do not affect a person with a normal immune system. True. Number 8, teens are not at risk for contracting HIV. That is false. Number 9, HIV is transmitted through blood, semen, and vaginal cervical secretions. That is true. And number 10, you cannot get AIDS by swimming in the same pool with someone who has AIDS. That is also true. Okay. So, kind of compare how you did, just kind of what you knew about HIV before we are going through this lesson compared to what we'll know at the end. Continuing on with the last 10 here. Number 11, HIV antibodies will show up in blood tests immediately after a person has been exposed to the HIV virus. That is false. It does take some time. Number 12, most people exposed to the HIV virus will get sick in a few months. That is true. So it does, while we had false for number 11, it doesn't show up immediately, but it does, show up in a little bit of time after. Number 13, the HIV virus attacks the CD4 T cells in the human immune system. We haven't used the term CD4 T cells yet, but those are our helper T cells, and that is true. Number 14, upon death of an AIDS victim, the CD4 T cell count falls below 15 to 20 cells per cubic millimeter of blood. That is true. 15, HIV virus particles are found in many of the lymph nodes in a patient infected with the virus. That is true. Number 16, you can get HIV after being bitten by a mosquito if it bit someone before you who has HIV. That is false. Number 17, like cancer, HIV can go into remission. That is true. 18, HIV only affects homosexual men and intravenous drug users. That is a big false. Number 19, there are different stages of HIV infection. That is true. At number 20, if you get infected fluid from an HIV positive person in your body, you will get HIV. That is false. It's not guaranteed, but it just does increase your chances a lot. For this, you can put your answers on your slide if you would like to, or just kind of review it mentally. This is for you just to look. I'm not going to look at your answers for this, just for you to gauge your risk of contracting HIV. So you could just circle or whatever your the ones that applied to you, and then we're just going to go through the ones that mean you're almost at no risk of catching HIV, a low risk, or a high risk. So the first 3 statements here mean that you are almost at no risk of catching HIV, never had sexual intercourse, have a sexual partner, and neither of us have had sex with anyone else, and my sexual partner has never shared needles with another person. Okay. All of those would mean that you have almost no risk of catching HIV if those applied to you. Number 4 is low risk. My partner and I use a condom each time we have sexual experiences. And then the rest of them are all high risk behaviors for catching HIV. So number 5, my partner and I have sexual intercourse without protection, which is just stupid. Number 6, I have had sexual contact with someone who has had sex with many other partners. Number 7, I've had sex with someone who uses intravenous drugs and whose needle history is unknown to me. Number 8, I share needles. Number 9, my use of drugs or alcohol sometimes leads me to have sexual encounters that I do not remember or would like to forget. And number 10, I've had sexual contact with someone whose sexual history is unknown to me. So 5 through 10 are all kind of high-risk behaviors that make you more likely to catch or contract HIV. All right, so looking now kind of at your notes that we're going to be filling in here. HIV is a virus, and it stands for human immunodeficiency virus. As the name suggests, it can only affect humans. It does attack our immune system, and specifically our helper T cells, and it is a virus. Okay. Medications are able to control HIV by kind of interrupting the life cycle of the virus, and that's called antiretroviral therapy. We'll talk a little bit more about that. And there are 3 stages to HIV infection. Where did HIV come from? Scientists have actually identified a type of chimp in Central Africa as the source of HIV in humans. There is a chimp version of an immunodeficiency virus. It's called SIV, or simian immunodeficiency virus. And it was believed to be transmitted to humans and then mutated into HIV. And that happened when humans hunted the chimps for meat and then ate, have food to eat, and then came in contact with their infected blood. And then it was able to species jump, similar to how COVID did, and then, mutated and was able to infect humans. It may have happened as far back as the late 1800s, and then spread throughout Africa and then to other parts of the world. It's believed that it was first spread to the United States in the mid-70s. For transmission and symptoms, for transmission, it's only going to be through certain body fluids, which could include blood, semen, pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk, that come into contact with the mucous membrane or damaged tissue of another person. Mucous membranes we would find inside the mouth, the rectum, vagina, and penis. And then just damaged tissue refers to broken skin, like a cut or a break in your skin of some kind, or if it would be directly injected into the bloodstream. So sharing hypodermic needles for drug use, that's also why, or part of why when you get a vaccination, you have a new needle each time, is to avoid spreading anything from person to person. Some symptoms of HIV, there's going to be the initial period of infection. They are going to be similar to other viral infections. So it can include fever and chills, could have a rash, night sweats, muscle ache, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. And then after it progresses to AIDS, there's a lot more things that can happen. So rapid weight loss, recurring fever, or profuse night sweats, so like that gets worse. Extreme and unexplained tiredness, prolonged swelling of the lymph nodes in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, pneumonia, red, brown, pink, or purplish blotches under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other neurologic disorders. So for the stages of HIV infection, we have our first of the 3 stages here. Without any treatment, HIV is going to advance in stages. So our first stage here is just called acute HIV infection. So within 2 to 4 weeks after infection is when people would start to develop those flu-like symptoms that we talked about. This is termed acute retroviral syndrome or primary HIV infection, and it's your body's natural response to the HIV virus being inside of your body. It's really important to seek medical attention during this phase if there's a risk that you could have been exposed to HIV, so that you can start ART drugs or antiretroviral therapy drugs. So if you think there was a chance you could have been exposed, seeking medical attention during this stage, especially if, 2 to 4 weeks prior to you developing these kind of flu-like symptoms, you engaged in some kind of behavior or activity that could have put you at risk. So during this time, large amounts of viruses are being produced in your body, and the virus actually targets our helper T cells, or CD4 T cells, and replicates inside of them and then destroys them in the process. During this stage, you would have a very high risk of passing HIV on to someone else because you have that virus replicating inside your body and you may or may not know you have it yet. So if you're engaging in those behaviors, like saying you maybe are sexually promiscuous, and you don't know you have it, then it's highly likely that you could pass HIV on to someone else. Stage 2 is called clinical latency. So the virus is still reproducing in the body, but it's not causing any symptoms, or if it is, they're possibly very mild. If the infected person is taking those ART drugs, they can actually live for decades without ever actually progressing to AIDS because the medication that they're taking keeps the virus in check. It is still possible to spread HIV to other people during this stage. For people who aren't on those antiretroviral therapy drugs, they typically live about 10 years in the second stage before progressing on to stage 3, which is when the person would develop AIDS. So AIDS actually will occur when your immune system is badly damaged, and the person's going to become vulnerable to what we call opportunistic infections, meaning that, like pneumonia, that a person without HIV, their immune system could fight off for them. That can kill someone with AIDS because they don't have those helper T cells to activate the rest of their immune response because they've been destroyed by HIV. So AIDS is typically diagnosed when the CD4 cell count falls below 200, or if one or more opportunistic infections develops. So that could be cancer, it could be tuberculosis, pneumonia. Okay. So AIDS is a condition. Again, as I mentioned earlier, it's not a virus. You cannot catch AIDS from someone else. So you can get HIV from someone else that can eventually become AIDS, but AIDS is not contagious. So you could be around someone who has AIDS, and as long as you are not sharing any form of body fluids with them, there's no way you could even get HIV from someone who has AIDS. Now, if you were, sharing a needle or, and when I'm saying you, I don't mean necessarily you in general. I'm hoping you are much smarter in avoiding behaviors like this, but you as in general, people. So if someone has AIDS and you are sexually intimate without protection, it is possible to get HIV from someone with AIDS, but just, for example, like sitting and talking with that person, you cannot even get HIV from them in that manner. AIDS, again, is a condition. It's caused by the HIV virus. It stands for acquired immunodeficiency syndrome. And with proper treatment, usually HIV can actually be kept from developing into AIDS. But again, that treatment can be expensive, and it's not widely, as in worldwidely, available to all people. Again, you can't catch AIDS from someone. It is not a contagious thing. Okay. So here we just see after the different, or the phases after the initial infection point. So in phase 1, and this is showing how many helper T cells you have in your blood. So initially, it drops and then starts to kind of come back. And then your helper T cell counts will decline. Once you reach that threshold of below 200, that's when phase 3 or AIDS is diagnosed. The amount of time in here, the amount of time spent in phase 2 is going to vary from person to person, especially if that person is taking those antiretroviral therapy drugs. Okay. Next, we're going to go through just kind of some timeline and history of HIV and AIDS in the United States. In the 1980s, a new disease appeared that research shows can be transmitted sexually through donated blood, IV drug use, and from pregnant women to their babies. So the first official reporting of what would become known as the AIDS epidemic happened in 1981. There was report of Kaposi sarcoma, which is a type of cancer, and pneumocystis pneumonia in 26 homosexual men in New York and in California. In 1982, the CDC uses the term AIDS for the very first time. Reports of AIDS being transmitted through blood transfusions and to infants happened in 1982 as well. So people, before AIDS was known, people were donating blood, and you were able, if you received a blood transfusion, it was possible that you could have gotten HIV through a blood transfusion. Since this time, they've done things to be able to test for HIV, so there is not a concern for that anymore in the United States. In 1983, there was a report of AIDS in female sexual partners of males with AIDS. The CDC says that most cases of AIDS have been among homosexual men, IV drug users, and people with hemophilia, and that's because they need blood transfusions regularly. The CDC says AIDS is not transmitted through casual contact, so like shaking someone's hand, giving someone a hug, that type of thing. In 1984, needle sharing is identified as a way for HIV to be transmitted. In 85, AIDS is determined to be caused by the HIV virus. In 1986, the Surgeon General at the time, C. Everett Koop, gives a report making it clear that AIDS is not spread by casual contact, and calling for there to be a nationwide education campaign to inform the public about what's going on, how it can spread, things like that. In 87 is when the CDC launched the first AIDS-related public service announcement, again, to get information out. In 1988, there were mailings sent to every household in the U.S. called Understanding AIDS, again, to provide information. In 1989, the CDC gives guidelines for preventing pneumocystitis carnii pneumonia. And here we can see people living with HIV and new HIV infections compared to the end of that decade. The rate increased quite a bit, and new HIV infections were also increasing. In the 90s, AIDS deaths increase. The CDC expands their prevention efforts to try to keep people from contracting HIV. In 1990, it was seen, there was a case where it shows possible HIV transmission to a patient through a dental procedure formed by a patient with HIV. So that was reported in 1990, where the patient or the dentist was HIV positive, working in the mouth on the teeth of a person, cut themselves, and then that blood got into through the mucous membranes of the mouth of the patient and spread that way. In 1991, the CDC is issuing recommendations for healthcare workers with HIV to keep them from spreading it to patients. In 1982, AIDS actually becomes the number one cause of death in the United States for men between the ages of 25 and 44. And at that point, or in that year, also the CDC officially says that when the CD4 cell count is below 200, that is at that point considered AIDS, the progression to AIDS. In 93, the CDC is getting involved at the local level to keep trying to prevent the spread of HIV. In 1994, they offer guidelines for trying to prevent HIV transmission through tissue and organ transplants. And then in 95, they give their first guidelines to help healthcare workers prevent opportunistic infections from spreading to people that are living with HIV. In 1996, there was the United Nations developed an AIDS program. In 97 is when the CDC first is showing that there are a substantial decline in AIDS deaths in the United States because they're starting to develop more medications to treat it. In 1998, the CDC says that African Americans account for 49% of U.S. AIDS-related deaths. There's lots of things wrong with that. Part of it is inadequate access to proper health care, as well as, if we're looking at, and I'm not saying that they would be denied health care, just, not depending on where they live, they might not have enough money to afford health care, which in the United States is appalling. Also in 1998, the CDC gives the first national treatment guidelines for using ART drugs in adults and in teens that have HIV. And then in 1999, programs are being launched to help combat AIDS in Africa. Okay. Again, we can see our numbers here. Number of people living with HIV increasing from 1990 to 1999. New HIV infections are dropping, so that's showing that some of those education campaigns are working. In the 2000s, so getting more into your guys' lifetime, there are global AIDS programs and funding to increase economic concerns over the increase in the HIV pandemic. In 2000, the United States Congress enacts the Global AIDS and TB Relief Act and authorizes $600 million in funding. In 2001, the CDC announces a new HIV prevention strategic plan to try to cut annual HIV infections in half within 5 years in the United States. In 2002, $500 million are given for an initiative in Africa to help prevent mother-to-child HIV spread. In 2003, over 2/3 of new HIV infections in the United States are from those who do not know that they are infected. So that's when most of the spread happens, is people don't know they have it. 2004, the CDC gives guidelines or guidance for HIV testing during labor and delivery for women who aren't sure if they are HIV positive or not. And then in 2005, the CDC gives recommendations to prevent HIV after non-occupational exposure to the virus. So if you were exposed to the virus and it wasn't like you were a nurse or a doctor taking care of an HIV positive patient. And then in 2006, the new HIV testing recommendations are released by the CDC. All people, they were saying, ages 13 to 64 should be screened at least once, with annual screening for those at risk, because if you can identify someone as being HIV positive before they've had the chance to spread it to other people, knowingly or unknowingly, you can help cut those new infection rates. In 2007, over 500,000 people have died of AIDS in the United States since 1981, according to the CDC. In 2008, the CDC estimates that there are 56,300 new HIV cases each year in the United States. And then 2009, more initiatives and campaigns are launched to keep trying to reduce the cases of HIV in the United States. So you can see, as of 2009, we're over 1 million people that are living with HIV, but the diagnosis of HIV is dropping. So that's showing people are living longer with HIV because of those antiretroviral therapy drugs, and it's also we're also being able to limit the spread. In the 2010s, so getting much more recent, there are drugs called pre-exposure prophylaxis, or PrEP drugs, that are known to prevent the transmission of HIV. In 2010, HIV was removed from the list of diseases that prevents non-United States citizens from entering the United States. In 2011, guidance is issued to healthcare workers on using PrEP as an HIV prevention strategy among men who have sex with other men. It's also reported that drugs to treat HIV can also reduce acquiring HIV. In 2012, the CDC reports that people between the ages of 13 and 24 represent over a quarter of new HIV infections each year. So really starting to educate people younger would help to reduce that number. And it also showed that 60% of the youth living with HIV are even unaware that they even are infected. In 2013, the CDC recommends PrEP drugs for people who use IV drugs. In 2014, the CDC announced that the annual HIV diagnosis rate declined by 30% from 2002 to 2011, which is great. In 2015, there was kind of like an outbreak of HIV linked to intravenous drug use in Indiana. At the time in Indiana, our former vice president, who was then the governor of Indiana, Mike Pence, refused to allow a clean needle exchange program for months after these cases were popping up to help stop the spread of HIV, because he didn't agree with people using IV drugs, which I totally get that. But at the same time, if you're in a position of power like that, you need to set aside your personal beliefs and do what is best for everyone. So that outbreak could have been lessened, not prevented, but lessened, had he allowed for people using needles to exchange them for clean needles rather than having to share needles among people and allowing HIV to spread. And then in 2016, the CDC releases a study that shows an increase in PrEP in those drugs could avert almost 20% of the estimated new HIV infections. So it's showing that those would work. If we look at 2010 to 2015, just in 5 years, the HIV diagnoses are continuing to drop, which is great. There are some PrEP treatments. There are some commercials out. This is one that's been out for a little while, so you may have seen this commercial. But this particular one is called Truvada for PrEP. Again, pre-exposure prophylactic to help prevent the spread of HIV. So people who are at a higher risk of HIV exposure, but are still HIV negative. So what would happen is they would take this medication every day to reduce their risk of contracting HIV sexually when combined with safer sex practices. So using condoms and things like that. It works by, in this particular medication, there are 2 medications inside of this Truvada PrEP med that interfere with an enzyme called reverse transcriptase, which HIV infected cells use to make new viruses. So those cells that are infected with HIV slow down or stop producing viruses altogether.
I'm on the pill.
I'm on the pill.
I'm on the pill.
I'm on the pill too.
But it's not birth control. It's Truvada for PrEP, a once-daily prescription medicine for adults that, when taken every day along with using safer sex practices, can help lower my chances of getting HIV through sex.
I use condoms, but I talked to my doctor about doing more. He said that because I had a higher chance of getting HIV through sex, Truvada for PrEP could be an option for me.
She also told me that Truvada alone may not keep me from getting HIV, and it does not prevent other STIs or pregnancy.
You must be HIV negative to take Truvada for PrEP, so you need to get tested for HIV immediately before and at least every 3 months while taking Truvada.
If you think you were exposed to HIV or have flu-like symptoms, tell your doctor right away. They may do more tests to confirm you are still HIV negative. Serious side effects can occur, including kidney problems, kidney failure, and bone problems, which may lead to fractures. Rare life-threatening side effects include a buildup of lactic acid and liver problems. Tell your doctor about all the medicines you take. If you are pregnant or breastfeeding, or if you have kidney, bone, or liver problems, including hepatitis. If you have hepatitis B, do not stop taking Truvada without talking to your doctor. Common side effects include stomach pain, headache, and weight loss. Ask your doctor about your risk of getting HIV, and if Truvada for PrEP may be right for you.
I wanted to do more. That's why I'm on that pill. Truvada for PrEP.
Eligible patients may pay as little as a $0 copay.
Okay. So again, a person would have to be HIV negative and have tests done every 3 months, like this said in the commercial here, for making sure the person is still HIV negative. So it is to kind of help prevent you. It's pre-exposure. So before you would actually be exposed, you would take this particular medication.
I'm on the pill.
Oh, we already watched.
I'm on the pill.
I'm on the
I think, yeah, that is our last slide. So this would be a recommendation that a doctor may give a patient if they are currently HIV negative. And it also said in the commercial, which is true, that you still should use this kind of medication, again, if you are at a higher risk for, if you engage in activities that would make you more likely to be exposed to the HIV virus. It would be used in conjunction with other preventative measures. Okay, so if you have questions, please let me know and I'd be happy to answer them for you.